The family and developmental history of Richard Chase. He was born on the 23rd of May of 1950 in California, USA. He grew up in a highly dysfunctional family environment. His father was described as an alcoholic, authoritarian, and confrontational. On the other hand, his mother had significant mental health problems and was reportedly seeing two psychiatrists when Chase was young. Childhood reports indicate bedwetting until age 8, animal cruelty beginning around age 10, and incidents of fire setting.
Educational and social history. Chase had an IQ of approximately 95, which falls within the average range. He completed high school, but struggled academically and later dropped out of college. He had difficulty maintaining employment and social relationships. Substance use and mental health history. During adolescence and early adulthood, he became a heavy user of marijuana, LSD, alcohol, and barbiturates. He developed bizarre beliefs about his body, believing drugs had damaged his organs and turned his blood into powder. He was repeatedly hospitalized for psychiatric concerns and eventually diagnosed with paranoid schizophrenia.
Although previous clinicians diagnosed Chase with paranoid schizophrenia, the current evaluation uses DSM-5 terminology, which classifies this condition under schizophrenia with prominent paranoid and somatic delusions. His diagnosis comes with supporting symptoms: persistent delusions, severe paranoia, disorganized thinking and behavior, impaired reality testing, social withdrawal, reduced emotional expression and motivation, long-term functional impairment across work, relationships, and daily living.
Richard Chase's psychological deterioration appears to be the result of multiple interacting biological, psychological, and environmental factors. Biologically, he may have possessed a genetic vulnerability to severe mental illness. Considering his mother's psychiatric history and his eventual development of schizophrenia spectrum symptoms. Psychologically, Chase displayed early warning signs such as chronic bedwetting, animal cruelty, severe health anxieties, bizarre beliefs, and increasing social isolation. Over time, these symptoms progress into a severe somatic and paranoid delusions. He became convinced that his organs were failing, his blood was poisoned, and consuming blood was necessary for survival.
Environmentally, chronic family conflict, unstable living conditions, substance abuse, and inconsistent psychiatric treatment may have contributed to worsening symptoms. His psychosis eventually became so severe that it distorted his perception of reality and influenced his violent behavior. Overall, the available evidence strongly supports a diagnosis of schizophrenia characterized by severe paranoid and somatic delusions, impaired reality testing, and significant functional impairment.
Recommendations: long-term psychiatric treatment. Continuous inpatient psychiatric care should have been maintained due to the severity of his psychosis and risk of violence. Medication management. Strict monitoring of antipsychotic medication compliance would have been necessary to manage delusions, paranoia, and hallucinations. Substance abuse treatment. Specialized intervention for marijuana, LSD, alcohol, and barbiturate abuse should have been implemented.
Ongoing risk assessment. Regular violence risk assessments and community monitoring would have been essential before any release into the community. Family psychoeducation. Family members should have received education regarding schizophrenia, relapse warning signs, treatment adherence, and crisis management. Richard Chase's case illustrates how severe untreated schizophrenia, combined with substance abuse and psychosocial stressors, can result in profound impairments in reality testing and have devastating consequences for both the individual and society.